You wake up one morning and something is wrong. Your head pounds, your throat burns, your body aches in a way that makes moving feel impossible. You reach for your phone, search your symptoms, and within minutes you have a diagnosis, a recommended treatment, and a pharmacy 2 kilometers away. Now imagine the same morning, same symptoms, but no phone, no pharmacy, no doctor, no hospital, no concept of germ theory, no antibiotics, no painkillers. The nearest person who knows anything about healing is a 3-hour walk through forest, and even they are working with tools and knowledge that have no resemblance to anything you would recognize as medicine. That was the reality for the overwhelming majority of human history. And yet here you are, which means it worked. Somehow, for hundreds of thousands of years, your ancestors got sick, got injured, suffered infections, endured parasites, survived childbirth, and kept going. How? The answer is stranger, more sophisticated, and more moving than most people expect. Let's start with what sickness actually looked like for ancient humans. Bioarchaeologists, researchers who study ancient human remains to understand health and disease in past populations, have given us a remarkably detailed picture. Examination of ancient skeletal remains from sites across Africa, Europe, and Asia reveals evidence of healed fractures, recovered infections, arthritis, tooth abscesses, and even signs of surgical intervention. These are not the remains of people who died young from every ailment. They are the remains of people who got hurt, got sick, and survived long enough to heal. One of the most striking examples comes from a Neanderthal individual known as Shanidar I, excavated from Shanidar Cave in Iraq by Ralph Selecki in the 1950s. This individual had survived to an advanced age despite having a withered arm, a healed eye injury that likely caused blindness, severe arthritis, and multiple healed fractures. This person could not have survived alone. Someone fed them, protected them, and cared for them, possibly for years. This is the first strong archaeological evidence that ancient humans, even before our own species, practiced deliberate care for the sick and injured. So care existed. But what did that care actually look like? Plants were the first pharmacy, and the knowledge of which plants to use, how to prepare them, and when to apply them was not guesswork. It was accumulated empirical knowledge refined over thousands of generations. Ethnobotanists, researchers who study the relationship between human cultures and plants, have documented hundreds of plant-based remedies used by traditional societies around the world, many of which have been validated by modern pharmacology. Willow bark, used by ancient peoples across Europe and Asia, contains salicin, the chemical precursor to aspirin. It reduces fever and relieves pain. Honey, used as a wound dressing across ancient Egypt, Greece, and traditional societies worldwide, is a genuinely effective antimicrobial agent. Its low water content and hydrogen peroxide production create an environment where bacteria cannot easily survive. Researchers studying the dental calculus, the hardened plaque on ancient teeth, of Neanderthal individuals at El Sidrón Cave in Spain found evidence of plants including yarrow and chamomile in their diet. These plants have no significant caloric value. The most plausible explanation, as argued by researchers including Amanda Henry and her team, is that they were being consumed for their medicinal properties. Yarrow is a known anti-inflammatory and has been used across cultures for wound treatment. Chamomile has documented calming and anti-inflammatory effects. This is not primitive guesswork. This is proto-pharmacology, a body of knowledge sophisticated enough to select specific plants from an environment containing hundreds of options based on observed effects that had been documented and transmitted across generations. But plants were only part of the picture. Social support was medicine in a way that modern people rarely appreciate. Research by evolutionary anthropologist Sarah Blaffer Hrdy on the evolution of human cooperation shows that our species evolved as cooperative breeders, meaning that care for vulnerable group members, whether infants, elderly, or sick individuals, was a core feature of human social life, not an optional kindness. The group invested in the survival of its members because the group needed those members. A skilled hunter who broke a leg was worth nursing back to health. A grandmother who carried accumulated knowledge of the landscape, edible plants, and seasonal patterns was worth feeding even when she could no longer hunt. A healer whose knowledge of plant medicine kept the group healthy was worth protecting. This social model of medicine had an unexpected side effect. It created specialization. In virtually every traditional human society ever documented by anthropologists, there is a role equivalent to what we might call a healer, a shaman, or a medicine person. Someone whose primary social function was the maintenance of group health. Someone who accumulated and transmitted medical knowledge as a dedicated specialization rather than as a side activity. Archaeologist David Lewis Williams, studying the role of shamans in ancient hunter-gatherer societies, found consistent evidence across cultures that these individuals served as the interface between the community and the forces they believed governed illness, forces we would now understand as infection, injury, and disease, but which ancient humans conceptualized through the framework of their cosmology. This matters because the social and psychological function of having a designated healer, a person whose role was to attend to you, perform ritual acts of care, administer plant medicines, and assert that recovery was possible, had genuine physiological effects. The placebo effect is not imaginary. It is a real, measurable phenomenon in which belief and social context directly influence biological outcomes. Ancient healers understood something that took modern medicine centuries to rediscover: that the mind and the body are not separate, that care, attention, and the belief that healing is possible are themselves therapeutic. What about more severe medical problems? Broken bones, infected wounds, difficult childbirths. Archaeological evidence shows that ancient humans set and splinted fractures. A healed femur found at a Neolithic site shows evidence of traction and alignment consistent with deliberate medical intervention. Trepanation, the practice of drilling or scraping a hole in the skull, has been documented at sites across Europe, South America, and Asia, dating back 9,000 years, and survival rates in ancient populations were surprisingly high. Researchers studying Neolithic trepanation in France found that the majority of individuals showed evidence of bone regrowth around the hole, meaning they survived the procedure and lived for years afterward. Childbirth was one of the most dangerous moments in ancient life. Human infants have disproportionately large heads relative to the birth canal, a result of our rapidly evolved large brains, which means human birth is genuinely dangerous in a way it is not for other primates. But even here, ancient humans developed solutions. Midwifery, the practice of trained assistance during birth, is ancient and universal. Virtually every traditional human society documented by anthropologists includes specialized knowledge about how to assist in difficult deliveries, how to manage postpartum bleeding, and how to care for fragile newborns. Wounds were cleaned. We know from ancient Egyptian medical papyri, including the Edwin Smith Papyrus dated to around 1600 BCE, but describing practices likely thousands of years older, that ancient healers understood that dirty wounds became infected and that cleaning them reduced mortality. They used honey, oil, and linen bandages. They differentiated between wounds that could be treated and wounds that were hopeless. They classified injuries by severity in a system that is recognizable as a precursor to modern triage. Here is the thing that ancient illness reveals about ancient humans most clearly. They were not passive in the face of suffering. They were empiricists. They tried things, observed what worked, discarded what didn't, and built bodies of knowledge that they transmitted carefully across generations. They did this without laboratories, without controlled trials, without any of the institutional infrastructure we associate with medicine. They did it through observation, memory, and the accumulated wisdom of people who cared enough to pay close attention to what happened when someone was sick. You wake up one morning and something is wrong. Your head pounds, your throat burns, your body aches. And somewhere in the deep history of your species, someone who loved you knew exactly what to do.